Hey y'all, my name is Taylor Browning, and today I'm going to be discussing with you guys some infection control procedures and universal precautions that we use as stylists in the salon each day. First, I'm going to start off with our universal precautions. These include hand washing, wearing gloves, proper disposal of sharp and contaminated instruments, proper first aid knowledge in order to not contaminate a client, cleaning and disinfecting of our tools properly, throwing away single-use items in the correct receptacle, disposing of contaminated tools in the correct bins, and using correct hygiene. Also, making sure that we are cleaning each tool and our station between each client. So now I'm going to discuss the 3 levels of infection control. These are what we use in the salon setting. First is cleaning. These standards apply to removing dirt and debris to aid in preventing the growth of microbes. Then we're going to disinfect. These standards require products to destroy or kill certain microbes or non-porous surfaces. This is step number 2. Step number 3, the standards state that all microbes must be killed or destroyed. This is important in the salon, and we usually only use cleaning and disinfecting. We don't really have to use sterilization, and the reason being is sterilization is only really necessary whenever it comes to an implement entering a body cavity, and 9 times out of 10, we're not doing surgery on the cosmetology floor, so we don't have to use sterilization. Next, I'm going to give 3 examples of how to not cross-contaminate in the salon setting. And one way to not cross-contaminate in the salon setting is by never using the same tools or single-use items on multiple clients. The stylist should clean and disinfect each tool and implement used after each client. Another way to not cross-contaminate in the salon would be by never double dipping or using a spatula to dip into a container to use a product, using the product, then using the same spatula and dipping back into the product that other clients and stylists use. You're not going to do that. So, a third way to not cross-contaminate in the salon would be by avoiding clients with infections that could put your other clients at risk. This is really important because we don't want to cross-contaminate diseases or infections or anything across our salon, and it's really important for the safety of ourselves and as well as the safety of our clients. We just want to have a safe, clean, and happy workspace just as much as the client wants to have a safe, clean, happy environment to have their hair done. So next, I'm going to define what disinfectant is using the NC State Board of Infection Control rules. According to them, disinfectant is defined as a disinfectant that is EPA registered as effective against bacteria, including Staphylococcus aureus, MRSA, Pseudomonas aeruginosa, viruses including HIV, hepatitis B and C, fungi including Trichophyton mentagrophytes, and human coronavirus. Next, I'm going to give 3 examples of everyday safety practices in the salon setting. So the first example would be whenever we spill water, we make sure to clean it right up whenever it happens. We want to prevent any slips or trips or anybody getting hurt because of water or something slippery being in the floor. So that is really important. And another way that we practice safety in our salon is ensuring to have proper ergonomics whenever it comes to being a stylist. Improper posture or repetitive motion can cause serious injury and pain to a stylist. You really don't want to have carpal tunnel syndrome or back problems or back aches or pains whenever we get older from doing these repetitive motions. And we make sure to use proper posture and proper hand position when cutting and styling the hair to ensure a healthy, long lifestyle. So the next way that we practice safety in the salon setting is ensuring that all stylists know first aid and how to not cross-contaminate their clients, and this is really important in the salon setting. So next, I'm going to demonstrate and explain the steps in hand washing. So first, whenever I wash my hands, this is my sink. I want to turn on the hot water, and I'm going to make sure that is the proper temperature. I don't want it being too hot where it's scalding my hands, and I don't want it being too cold. I want it to be warm water to make sure that I'm properly washing my hands and getting off all the bacteria that's on my hands. So I'm going to turn on my warm water. I'm going to test it, and then I'm going to rinse my hands. And then I'm going to get me some soap without turning the water off, and I'm going to wash my hands for 20 seconds. I'm going to make sure to get between my fingers, under my nails, all the important stuff. You make sure that you get everything because you want all of your hands to be clean. So it's been about 20 seconds. I'm going to go ahead. My water is still on. I'm going to go ahead and rinse my hands. Go ahead and rinse that soap off. I'm going to grab me a paper towel. I'm going to blot my hands dry. I'm going to throw that paper towel away after my hands are completely dry. I'm going to grab another paper towel, and I'm going to turn off the water. And that is how you properly clean your hands. The next thing I want to do is explain implement disinfection to you guys. So I just got done with my client. I have a comb that's dirty. I need to clean it. The first thing I'm going to do, I'm going to put on my gloves. I'm going to go back to the dispensary, and I'm going to remove all hair from the comb. And I'm going to rinse it off, and I'm going to wash it with soap and warm water. And I'm going to wash that comb with soap and water. And then I'm going to rinse it off. I'm going to get me a towel, and I'm going to dry off that comb. And I'm going to immerse it in my barbicide or disinfectant solution that I use to disinfect my implements. I'm going to leave that for 10 minutes. Make sure, depending on what solution that you use, that you are checking your manufacturer's directions to make sure that you are immersing and disinfecting your implements the correct amount of time. And I still have my gloves on. I'm going to take it out of the solution once it's completely disinfected for the right amount of time. I'm going to close that lid, and I'm going to rinse off my comb in the water. Make sure it's good and rinsed. I'm going to give me a towel. I'm going to dry it off, make sure it's good and dry, and then I'm going to take my comb or my implement or whatever you're disinfecting, and I'm going to take it to a clean container or a clean, dry cabinet. The next thing I want to explain to you guys is the steps in both blood exposure procedures. Okay, so this is when the first thing I want to explain is if I was to cut myself. So I'm cutting my client's hair, I cut my finger. I'm going to stop the service. I'm going to say, excuse me, ma'am, sir, I just cut myself. I'm going to go back to the dispensary and get cleaned up. So I'm going to go back to the dispensary. I'm going to wash my hands very thoroughly, including washing inside the cut, making sure that cut ain't got no debris or nothing in it. And I'm going to wash my hands and make sure it's good and clean. And then I'm going to get my first aid kit out. I'm going to open it up, and I'm going to clean this wound and put some antibiotic solution on it. And after I get my antibiotic cream on it, I'm going to put on a Band-Aid. And then I'm going to apply a glove. After I do that, I'm going to make sure to clean any tools, anything, my station, anything that got infected during the time that I cut myself, depending on how big or little of a cut it was. And I'm going to come back in. I'm going to take this glove off, and I'm going to put another glove on, and I'm going to go and continue with my service. I actually lied. So, after I put on my Band-Aid, I'm not going to put on a glove. I'm going to wash my hands first. And then, after I wash and dry my hands very thoroughly, I will then put on a glove to go clean. I'm going to come back. I'm going to take that glove off. And I'm going to wash my hands, put another glove on, and then go ahead and continue with the service. Sorry about that. Okay, so next I'm going to explain what would happen if I was to cut my client. Sammy, I hate to take you from your nap, baby, but I need you for a second. So, say, Sam, here is my client. I just cut her on her ear, And I would explain to her, you know, I accidentally just cut you. Let's stop the service. And we're going to go back to the dispensary and get you cleaned up. And Sam's going to say, okay. And we're going to go back to the dispensary. I'm going to wash my hands, and I'm going to ask Sam to wash her hands. And we're going to wash our hands. Yeah, we're going to wash our hands, Sam. And then I am going to put on a pair of gloves myself. I am going to clean Sammy's ear very well with soap and water. I'm going to make sure it's cleaned and rinsed off. And then I'm going to take some antibiotic solution, and I'm going to put on her cut. I'm going to put on a Band-Aid on Sammy's poor little ear, and a covering or whatever. If you have ear covers that you could cover, you could put on an ear cover. If not, the Band-Aid will be fine. And after that, I'm going to ask her to go sit down. I'm going to go take these gloves off, put another pair of gloves on. I'm going to go clean my station. Sorry, Sammy's making it. Okay, you're not needed anymore. Go sit in your chair. Okay, she's sitting in her chair now. So then I'm going to clean my station, clean any implements that could have been contaminated, and I'm going to go back, clean that, remove my gloves, and continue with the service. And that is all I have for today on infection control. And I hope it helped. Thanks for your help, Sammy. You did great.